But you can extrapolate that kind of information to any joint of the body. So here's a healthy joint. So this would be my right knee, okay, looking at you. Here's the cartilage surface, here's the kneecap, here's the meniscus, right? Here's the anterior cruciate ligament, here's the lateral meniscus, and here's the lateral medial collateral ligament, here's the lateral collateral ligament. Okay, these are your two lower leg bones. So here's the ticket. Bone spurs, cartilage loss, swelling, pain, adhesion, scar tissue, deformity, and disability are related to the body's unbalanced attempts to restore and regenerate itself. In joints, osteoarthritis is the end result of that. So it begins to damage cartilage and other tissues of the body. And have you ever heard the term bone on bone? Okay. There isn't such a thing as bone on bone. There's always cartilage in there. All right? It should be more like a pancake, but sometimes it gets down to like a tortilla. So it's degenerating for sure. Can that begin to regenerate? The actual answer to that is yes. Can you get brand new cartilage just like you were 15 years old? No. It's not going to happen. But it's going to improve. Most importantly, we want to get rid of pain and swelling and start tightening up some of the soft tissue, the ligaments, tendons, etc. So here's a typical treatment cycle. We have joint pain, and we get non-steroidal anti-inflammatory drugs like ibuprofen. Do those drugs correct anything? Can they cause problems? Yeah. So we end up with the same or increased pain because we really never got at why it's degenerating in the first place. We need stronger drugs, stronger NSAIDs. We take x-rays, we get cortisone injections. Anybody had a cortisone injection? Okay, we're going to talk about that in a little bit. MRIs, arthroscopic surgery. I've had a couple of them. I've had 3 of them actually. 2 went fine, and they were necessary. The 3rd one probably wasn't necessary, but it was what was described as torn cartilage. And before I knew what I know now, 2.5, 3 years ago, I would have never had the surgery. And then there's surgery. So let's talk about NSAIDs. What do the pain meds really do? They're just there to alleviate pain or to basically fool the brain that there's not pain signals being sent to it. But they do not cause or address the cause of the tissue damage, and the tissues continue to degenerate over time. They don't heal or regenerate anything, and they're linked to ulcers and heart attacks and 15,000 deaths a year. So what about cortisone injections? Have you been told that you can only have 3 of them? Right. So what do? They go in and hopefully help inflammation. That's all they're supposed to really do. Sometimes they work and sometimes they don't. But they don't generally last for very long. Who's had one that's worked? And did it work permanently? No. And unfortunately, it's not only temporary, but cortisone actually goes in and damages tissue and causes more arthritis. That's why you can only have 3. So the doctors are trained to tell you that you can only have 3. Yeah.
What about that rooster comb stuff that they talk about?
Good question. We're going to get into that in just a second. So cortisone or HA injections, high hyaluronic acid, rooster comb. That's what HA stands for, high hyaluronic acid. Cortisone will degrade bone density and cartilage over time. It eventually worsens, speeds up the joint degeneration. It's only temporary, it wears off. Can increase or worsen systemic diseases like diabetes because it causes insulin resistance. High hyaluronic acid is like a lubricant, a WD-40, a little cushioning material, but it only provides temporary relief, right? maybe 3 months, somewhere in that neighborhood. Has anybody had that? And how long did that last?
Well, I just had the 3 shots. 1 month ago now, I had the last one.
Okay. And how many did you have?
I have 3.
And-
The first series of.
Okay. And so,
And they told me I could get it again in 6 months.
yeah, you can keep getting it. Dr. Dixon, is there any negative effect with hyaluronic acid given multiple times over time?
No, typically no. Insurance sometimes doesn't cover it on an unlimited basis, but it can be.
Right. But here's the ticket. It's not regenerating anything. Right. Anybody else? Did you have it?
Yep.
And how did it work for you?
Or just a little bit, but
Yeah. And then that's typically what we see. We could do it. We don't really generally do it in our clinic, but sometimes people will ask for it and we will accommodate at that point in time. But we would prefer to actually get into the regeneration of this. It's a much more permanent solution, if you will.
what exactly is it that they're putting in there? I
In
had an impression it was like a gel that's going in there.
the hyaluronic acid,
Yeah.
the rooster comb, it's a gelatinous kind of material. Hyaluronic acid is produced throughout the body, throughout our lifetime. And so it's just, you know, a super jolt of hyaluronic acid in that joint. But it's just going to dissipate. They both buy time before surgery. So then surgery. All right, you got a weak tummy? Look at the table or whatever, because sometimes orthopedic medical doctors like to show you knee replacement surgery with just a picture, a drawing. Well, it doesn't look like that, believe me.
I've seen it.
Yeah. So this is what I've had 3 times. Basically sticking these devices into your knee to go in and shave away cartilage and kind of clean things up a little bit and get out of there. Sometimes it's necessary. If you've got a piece of cartilage that's broken loose and getting jammed in there and locking your knee, you need surgery. And you know what you need 2 weeks later? Regenerative therapy to help you heal even better. So that's knee replacement. That's a hip replacement. So the problem is this. The American, and this comes from the American Academy of Orthopedic Surgeons, the 30-day mortality rate for total knee replacement is 1 in 400 people will die from it. But there's other risks. There's anesthesia risks, there's infection risks, there's bleeding risks, there's clot risks, there's swelling, there's breathing problems, there's nerve and artery damage, there's allergic reaction to the plastic or metal components, and there's implant failure. We had one of my buddies who retired from softball 2.5 years ago, and he's in the Softball Hall of Fame, great softball player. Had to have knee surgery. We just found out last month that he's got to have the same knee redone again. They don't always work out. My mom's had both of her knees replaced, and one of them replaced twice. She had the second replacement when she was in her 70s. You talk about tough rehabilitation. Now there is no third knee replacement. So the younger you are, the bigger the problem is. Now some doctors say, oh, this will last for 20 years. That's stretching it a little bit. Or say it lasts 10 years, but you're 60 years old. You know, what is that going to look like? There may be a better alternative, and I want to talk to you about that tonight because it can save you. It can change your life. It can absolutely change your life. Because sometimes things don't work out too well. And there's lots of rehab, especially on those second ones. Lots of rehab. And things sometimes don't turn out very well.
I hear an awful lot of people in this chamber talk about those with disabilities. And that's trying to do things to help them. But I'll be damned if we don't have the chance tonight to hear the very next bill that opens up the doors of medical science and that brings not science fiction. It's biology.
One of the joys of using stem cells is there's almost always lots of upside and no downside.
In the tens of thousands of administrations that we've given, there have been no serious adverse events.
I went into practice because I wanted to help people. Not just put Band-Aids on people, but really get to the root cause and fix it. And that's exactly what this is.
Patient after patient after patient, continuing to see these miraculous changes.
She was back to training for marathons. To her, that was a miracle. To me, I wasn't surprised.
It's one of those things that are too good to be true.
Tell me why you're so emotional.
As of a month ago, he doesn't wear oxygen at all.
This is your life. This is the life of your wife or your husband, your sons, your daughters, your family members.
What does your wife think of the new you?
We go on so many dates, I don't know where to start. I'm just glad she's happy.
It is so exciting what's going on. You know, the fact that you could literally take your own stem cells and bank them and have them available.
This could benefit me, my family, and just think of the larger implications of actually helping all of the, the people that I've served with, and I see that, they're in just as much pain.
Neurological conditions, things like Parkinson's, MS, ALS, traumatic brain injury, autoimmune diseases, diabetes, lung, heart, kidney, essentially any organ or tissue inside your body that needs to have healing can be used with these cells.
It's not the fountain of youth, but maybe it's some droplets from the fountain of youth. You're putting these cells in that actually regrow tissue.
I played 16 years, 100 or more games a year. Since then, I've been able to speak to a lot of people, not just athletes, who have gone through this process and have had raving reviews about it.
I know the research that's going on right now, in a year, will just blow away what we're talking about today.
Can you imagine if we can not just take care of injuries and diseases, but actually even prolong healthy, functional life?
This is revolutionizing medicine as we know it.
So they're talking in there a little bit about systemic related issues, neurological issues, and we don't do that at our clinic. I believe it's got some promising results. We may consider doing that at some time, but the joint regeneration has been around for a lot longer. We're very confident about what we can offer if people are accepted as patients at our clinic. But this is where what the future holds for us. That's why this is such exciting information. You've also heard that we can use our own stem cells, and that's true, and there's certain benefits to that. There's bone allografts, meaning you take your own bone out and you spin it down and you take the stem cells out of there and you inject them into the problem joint. There's a couple of problems with that. One is you're under anesthesia, and they pound this, basically a nail of a needle into your hip, and they just take a hammer and pound it in there, and they draw out this material and they spin it down. So there's a chance of infection there too, besides the anesthesia. There's another problem there, and that is, for myself, I'll be 68 this year. If I were to use that, I'm putting 68-year-old stem cells into my own body, right? Whereas when we use amniotic allograft from planned C-sections, by the way, there's no embryonic tissue ever used in America today for stem cell regeneration. But if we take an amniotic allograft from a planned C-section from placenta, now we got 9-month-old stem cells in there. So you see the regenerative capacity. That's why children heal so much better. When a baby is born, they have 1 out of every 10,000 cells are a stem cell. When you get to be 50, 1 out of every 400,000 cells are a stem cell. And I've heard that when you get to be about 70, 1 out of every 2 million cells are stem cells. That's why we don't repair very well as we age. So Mother Nature has given us this gift, and science is beginning to use it now. So let's talk about costs. Average knee replacement, $46,000 to $76,000. Out-of-pocket deductibles, if you've got insurance, in the $4,000 to $15,000. Amniotic allograft is not covered under insurance. There's a number of things. We do medical weight loss at our clinic. It's not covered by insurance. You know what's covered with weight loss? Bariatric surgery. Sewing your stomach down to a little tennis ball. Sometimes that works for people, sometimes it doesn't work for people. That's covered by insurance. But teaching people lifestyles and trying to make it a permanent solution for their weight loss, not covered. Is it fair? Is it the right thing to do? I don't think so. The reason I'm bringing it up is because you need to understand that if you're going to do this procedure, it's an investment in yourself. It's an investment.